Good morning, folks. Ron Ray here with Turning 65 Solutions. For today's video, we are going to look at a problem that we have faced and a question that we've faced for quite a while now, and we're getting this question more and more often. And that question is, which Medicare Supplement Medigap plan is better, Plan G or Plan N? And we've talked about each of these plans individually several times on our channel. We've just updated each of those videos for 2023. We've got a great page on our website on each of them. I'll put links in the video description down below, but we haven't really done a video recently comparing the two and making a decision which one is best. Now, the first thing we need to do is compare the two, the Plan G and the Plan N, and see actually what's the difference between the two as far as benefits. And to do that, we're going to go straight to the horse's mouth to this book right here. I reference this thing all the time. You can download a copy of it free, no email address even required on our website. I'll put a link in the video description down below. It's called Choosing a Medigap Policy, and this comes right from the government, from Medicare.gov. And you can download it right there. You don't even need to put in your email address. I just put that on there so it's easy to find. And I'll put the link down below. And what it does is it compares all the Medigap plans that are available currently. Now, some of these are available to you and some of them aren't, but we're going to talk about the Plan G and the Plan N today. And if we look quickly at the Plan G, it covers 100% of your share of the Medicare bill, except for that $226 annual deductible for Medicare Part B. That's the only thing that it doesn't cover. Now, it does cover foreign travel. That's a little bit different. We'll talk about that in another video. But for Medicare covered things, it covers 100% of Part A coinsurance, 100% of Part B coinsurance, 100% of the first 3 pints of blood, 100% of Part A hospice, 100% of skilled nursing facility care, 100% Part A deductible, and 100% of Part B excess charge. That's that 15% excess charge that some doctors are allowed to bill you. Now, that's going to be important to know later. We'll talk about that in a minute. The only thing it doesn't cover is the Part B deductible, which in 2023 is $226. Now, the Plan N, you can see, is very similar. It covers 100% of Part A coinsurance, 100% of Part B coinsurance. Now, the little stars here, what that means is that for a doctor's office visit, you can be billed up to $20, a $20 copay for the doctor, $50 at the emergency room. Some doctors bill that to you, some don't. I don't really ever know, but it's no more than $20 at the doctor, no more than $50 at the emergency room. Now, if you go to the doctor once or twice a year, that's not really a big deal. I'll explain why in a minute. Covers 100% of first 3 pints of blood, 100% of Medicare Part A hospice care, 100% of skilled nursing facility care, 100% Part A deductible. Like the Plan G, it does not pay the Part B deductible, that $226 a year. Here's the big one though, it does not cover that 15% Part B excess charge. Now that can be a big charge. You know, if you go to, a specialist that's, charging a hefty fee, or a surgeon that doesn't accept Medicare assignment, 15% of that fee can be quite a lot of money. We feel that it's not going to come up very often. And let me tell you, I'll tell you why in just a minute. Okay, so they're very close, a Plan G and a Plan N. A Plan G covers everything except for the Part B deductible. A Plan N covers everything except for the Part B deductible, the 15% excess charge, and you can be billed up to a $20 copay at the doctor, $50 at the emergency room. Okay, so that's the main differences. The only differences really in benefits between a Plan G and a Plan N. Now, we said the $20 copay, probably not a big deal. You might end up paying that once or twice a year. Not really a big deal when you look at the cost savings between the two plans. The big one is this 15% excess charge. So let's look at that. And we have to ask ourselves first, how many doctors actually are going to charge that? It's only certain doctors that are allowed to charge it, and they're called non-participating providers, or doctors who do not accept Medicare assignment. Everybody else is a doctor who accepts Medicare assignment, okay? Those doctors who accept Medicare assignment, they're also referred to as participating providers. They're not allowed to bill that 15% excess charge. So if we want to find out how many doctors actually accept Medicare assignment, well, we just go looking for the stats. And I've gone to the Kaiser Family Health Foundation. I feel like they're a pretty trusted source for information, kff.org. And there's this article. Article's getting a little dated. It's about 1.5 years old, but I feel that these numbers are still pretty strong. So if we look, we're going to scroll down here and look, see what are the current stats. So participating providers, these are doctors who accept Medicare assignment. And what that means is they accept Medicare, what Medicare pays them along with your share of the 20% as payment in full. And they are not allowed to bill you anything above that. So between Medicare paying their 80%, your Plan N or Plan G paying your 20%, after you've met the deductible, you have zero responsibility. And what we find is that covers 97% of all physicians and practitioners billing Medicare. They are participating providers. Now, they're incentivized to be participating providers. Medicare pays them up to 5% more just for being participating providers. So that's why you're seeing those numbers actually climb. That number wasn't that high the last time I did this video in about 2020 or 21. It's time to update it. So in just 3 or 4 years, we have seen that number climb. Now, if we look at non-participating providers, these are the ones that can get us. That's going to be about 3% of all physicians who bill Medicare are going to be non-participating providers. But here's what I found interesting. In 2018, 99.6% of fee schedule claims that were submitted by non-participating providers were actually paid on assignment, right? So that means that for 99% of the 3% of doctors who are allowed to bill the 15%, they didn't. More than 99%. Okay? So I want that to sink in. 99.6% of Medicare claims by doctors who are allowed to bill the 15% were billed on assignment, which means they were not allowed to bill the 15%. In other words, they chose to take the guaranteed 5% extra from Medicare rather than having to chase you down for an extra 15. Okay? It's more in their favor to do so. Now that leaves 0.4% that billed off assignment, non-participating, off assignment, meaning that the 0.4% of those bills, those claims, were allowed, and we don't know if they did, but we know that they were allowed to bill that extra 15%. And then there's a small percentage, less than 1% of doctors who just don't take Medicare at all. Now, you're going to know that ahead of time because when you walk in and hand them your Medicare card, they're going to say, nope, sorry, we don't take that. Very rare occasion you might have somebody in an emergency situation or a surgery where you might run into, say, an anesthesiologist that doesn't take it. Again, almost always you're gonna know because they're gonna get your, what do they do? First thing you do when you walk in the door, you hand them your insurance card and they'll say yes or no, we take that, and then you have to reschedule or find another doctor. So I'm not real worried about this 1% because that's not going to happen anyway because you're not going to see them. What I am worried about is this 0.4%. 0.4% is a very low number in the big scheme of things. So 97% of doctors are not allowed to bill the 15%, and out of the 3%, 99.6 times that they bill, they do not bill it in such a way that they're allowed to charge you the extra 15%. So I think the odds of you actually having to pay the 15% extra are very, very low. Okay, so keep that in mind. That's the main point here. So the next thing we want to go do is say, okay, if a Plan G is so great and a Plan N is pretty darn close, but I might have to pay a little bit extra. I might have to pay $20 if I go to the doctor, and there's a very, 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 very small chance that I might have to pay 15% extra for a service or procedure. Well, what's the savings? There's got to be a savings. A Plan N has to cost less. And it does. It does cost less. And so I've got this little spreadsheet I made of some of our Medicare supplement carriers that we like in our area. And we're in the San Antonio, Texas, New Braunfels, Texas, up to Austin, down to Corpus area. And of course, we work all over the state of Texas and in multiple states where we have agents. But just to give you an example of the savings, if we look at a female turning 65 in our area, New Braunfels, Texas, for a Plan G, she is going to pay $99.43 a month. And that's going to be very, very good coverage. But a Plan N would cost her $74.44. That's a savings of $24.99 a month, or just about $300 a year. And that's with Aetna. And then we can look at Mutual of Omaha, saves about $254. Cigna saving about $370. United Healthcare, about $268 savings. So you can see somewhere between $300 and $370 savings, depending on the carrier that you like. Some of these carriers like Plan N a little bit better than others. Old Surety doesn't even have a Plan N. Humana doesn't seem to, isn't priced as great. So it doesn't matter. This is the example I wanted to make is, look, you're saving about $300 a year. So if we think about how many times do you go to the doctor that you might pay that $20 copay? Most people that we work with go to the doctor 3 or 4 times a year. So you're looking at, $60 to $80 that you could possibly pay out of pocket for those doctor's office visits. And for a male, it's going to be about the same, somewhere between $300 and $415 savings. Cigna is quite a big difference between a Plan G and a Plan N for a male in our area. So if you're saving $400 a year on that Plan N, and maybe you have to pay that $20 copay 2 or 3 times a year, you're still in the money. You're still far in the money, in our opinion. And a Plan N has a tendency, this is not a hard and fast rule, but it's a pretty good trend, a tendency to go up in price slower than a Plan G. You see, a Plan G has to take all those people that are coming in on what we call a guaranteed issue basis, regardless of their health. And a Plan N doesn't, except when you're turning 65 is the only time a Plan N has to take you in without health questions. So because of that, and because a Plan N typically has to pay out a little bit less because you might have to pay the $20 copay, a Plan N rises in price a little bit slower than a Plan G. And we have those trends now since the MACRA law went into effect in 2020. We've got a couple of years of track record on these companies. So what we feel is that for most people, a Plan N is probably going to be the way to go. Again, I think it's a very low chance that you'll ever pay that 15% excess charge. And by the way, in most cases, it's 100% avoidable anyway, just by simply asking the question, how do you bill? Do you bill on assignment, or do you bill as a non-participating off-assignment provider? Okay, how do you bill? And am I going to be billed the 15% excess charge? If the answer to that question is yes, then guess what? Go find yourself another doctor. Okay, so even for that very small percentage, it is avoidable simply by asking that question ahead of time. So at this point in time, 2023, it's February, we think that a Plan N is probably going to be your best bet. Now, if you just don't want to take a chance, or you're somebody that goes to a doctor 2 or 3 times a month, and you think that those copays might add up, then a Plan G is a great choice as well, and we certainly support that. So what we do is we work with you to figure out which plan is going to be the most advantageous for you for the longest period of time, and then reviewing that each and every year for you. So we've got great articles, again, right here on our website at t65s.com. I'll put links to these websites down in the video description down below. You can read all about it. Now, if you've enjoyed the information in this video, I know it's been a little bit longer one, but I had to really get you all this information and lead you to how we make these determinations. If you enjoyed the information in this video, please give us a thumbs up down below. That helps YouTube get this video out to other people who are seeking the same information that you were today. And also, don't forget to subscribe to the channel so you can be notified when we upload a new helpful video. We're doing a lot of updates from older videos that we have, and we're adding lots of new content each and every week. So we hope you enjoyed it, and give us a call. The number is 830-217-6711. If you have any questions at all, 830-217-6711. Also, look us up on the web at www.dt65s.com. Until the next time, we hope you have a great day, folks. Bye.